Bring that chair. Hello, I'm Michael Santos, I'm a Spinal consultant. Is everything okay?
Not really, no, because I feel like I've been given the runaround.
Which round is this?
I got diagnosed with my problem April last year,
Okay.
and it's taken, 14 months for someone to do something.
Alright, I see. So you're ready to complain. Okay, so let's start over. I'm Michael Santos. I'm a
And
Spinal
since then,
consultant.
my legs have got worse.
Okay,
I
that's
can't.
fine. Today is the first day I'm meeting you, isn't it?
Yeah, first time I met somebody else.
Okay, that's fair enough. So,
I don't know when it was.
that's fine. So today is the first day I'm meeting you. So this is all.
So I've got brain damage and I'm deaf.
That's okay.
That's another reason she's me.
That's fine. You want me to speak louder?
Yes, please, if
Okay,
you
that's
don't
fine.
mind.
That's fine. You want me to speak slower?
No, normal
No.
pace. I just need it to be clear. I'm having problems with my hearing aids.
That's fine. That's fine. So we'll go through a lot of these things. I know that I tell you what I know, and you'll need to fill in the rest.
Okay.
Yeah?
If I can, yeah.
Yeah. So I know that you've had brain trauma before, and you've recovered really well from that.
As far as I can tell,
Yeah. And you've done even back to independence, yeah?
Yeah.
Yeah, some level of working, etc.
That was the brain trauma is from the year 2009, November 99, December 99. That is brain damage is from the car accident back in November 99.
Exactly. Yeah. So
I was in a coma till about January 2000.
yeah, exactly. And then did you have surgery on the brain?
I couldn't tell you.
Did you have surgery on the brain? Your mom?
She won't know. She won't know.
Who are you?
She's my girlfriend.
Okay, fair enough.
So she
What's
won't
your
know.
name?
Alison.
Alison. All right, Alison. So Alison's your next of kin. Who's next?
She's my next of kin, yes.
Okay, that's fine. All right. And so, and you've done, based on the letter, you've done really well. Yeah? And you work?
No, I can't work. I've
What
been
do you
declared unfit.
So-
I have worked in the past.
Yeah. So
After the accident,
correct.
I've worked.
This is what I'm saying. So what
But
work
in the
were you
last
doing?
10 years, I've not worked.
Okay, fair enough.
It's warehouse mainly. Warehouse and bar work was my main work. But I've been declared unfit by the job centre.
Okay. And this is because of the head injury or something else?
Something else, I think, is to do with my mental health.
Okay, fair enough.
And plus me being deaf. I don't know whether it's to do with the brain damage, but I know mental health has a lot to do with it.
Okay. What is the mental health problems that you have?
It's my depression. I've had it for quite a long time. I've been on medication for that for quite a while.
What medication you take?
At the moment, I'm on metazapine, if that's how you pronounce it.
Yeah, metazapine.
Before that, it was something else.
How long did you have depression before the accident?
Yeah, I've had depression on and off most of my adult life.
Oh, sorry to hear that.
Yeah.
So let's see. So you're 40. It's more than 30 years.
Yeah, something like that. Yeah.
Okay.
Can't pinpoint it
No,
exactly.
That's okay. So you're hearing impaired bilaterally.
Yeah, both through meningitis, sepsemia as a baby,
Okay, so meningitis.
and septicemia, and then it got even more severe after the car crash that we've just been talking about from November 99.
Okay, so you had a car crash.
Yeah, I was on a push bike, car smashed into me, fractured my skull, smashed both my eye sockets, and I ended up with frontal lobe brain damage.
Mm-hmm. Well, to be fair, you're doing amazing. Because normally you'd be like, it's good. You
I have my moments. I used to be really bad. I used to react really bad to things
yeah.
because of I've been told it's the cognitive
Yeah.
thinking.
Once you
I only
smash
see
the front,
negatives.
Yeah. Once you see the front, like you don't have any. It's just all impulsive. So that's understandable. It's not.
I have my moments, don't
Yeah,
I? I'm
yeah, of
not
course.
sick to tell you. I mean, we've been together 3 years. I've moved from Stoke and moved in with her about 3 years ago. So she could give you her version of events from me.
Yes.
But I feel I'm a lot calmer now than I used to be. I used to like what they call blue touch paper. Say something to me and I'd just go off.
Yeah.
On
I
one.
mean, well, certainly, so you're ready to do that just now. So that's why I was like, oh man, this is going to be one of those days. No, just joking.
Takes me. It does take me a while. I don't know. It's
It's
signal.
okay. It's
I mean,
okay.
no, I've got both hearing aids in, but I've got most of my life that I couldn't hear in that ear.
Yeah.
But since it's gone digital,
Yeah.
found some hearing last year or the year before,
Oh.
and they've given me Bluetooth hearing aids that's adapted to the phone and technology. but it's playing up at the moment. So the next visit is, because we live in Halifax, so it took us nearly an hour to get here. So my next one is to contact Bradford Hospital, which takes about half an hour journey, to get an appointment with them to come and for me to go there to get them fixed so I can hear better again. So
I think that, okay, that's fine. So I know that you've been seeing another consultant just a few weeks ago.
Once,
yeah, Mr. Rao. Yeah,
I believe so.
Yeah. Okay.
I don't remember names.
That's okay. That's okay. So I want you to try your best to tell me what is the. So you don't have a neck problem.
No, it's
your
the
hands are fine.
cyst.
Is some cyst in the back, some facet cyst.
Well, from what I can gather and the way my logic works, the cyst is at the bottom of my spine.
So forget the cyst. When did the problems in the back start?
Got diagnosed back in April last year. I was rushed into hospital as an emergency, thinking it was something beginning with E.
Equine.
Called equine.
Yeah, but it turned out to be something else. But it took them 2 different hospitals and 3 days to find out.
Where did you go?
I ended up at Halifax.
Calderdale Hospital, and then they transferred him to Huddersfield Royal Infirmary.
I ended up with half a dozen scans, X-rays, and MRI, and then it's the one with the dye. That's when they found the situation.
I see. So you had MRI.
They couldn't find it at first.
So X-rays,
ultrasounds as well.
Ultrasound, MRI, and then you had the contrast. This is in October.
Because when I had that done, it was April last year.
25th of April.
It was on her grandson's birthday. That's why we remember it.
Yeah.
That's when I came out. That was the day I came out. So it was like 3 days prior to that, wasn't it? That was the 3rd day I was in.
Before he was taken in, he was having problems with his legs. They
yeah.
were like numb.
Yeah. So in April.
That's when he got diagnosed.
See, April, that's when you had this cyst problem, yeah?
Yeah, that's what we're thinking that's caused my leg problems.
Okay, so that's fine. So what is the leg problems that you begin in April?
Right, I can't stand for too long. The pressure pushes down my back to the bottom, like my backside, and it weakens my legs.
Which leg is worse?
My right leg is the worst one.
So if you stand, you have back pain, lower back pain?
It's not so much the pain, it's the pressure.
Pressure.
Pressure pushing bearing down. But then the pressure went into my knees.
So the pressure, and then it's not pain running, but the heaviness is in the knees.
There was a lot of pain to begin with. There's a lot of pain. I'm on painkillers and stuff now for it.
So you have shooting pains or paresthesia?
It's different every day.
So
I have had stabbing pains, and I've had shooting pains, and I've had like static like reactions, like with legs flickering.
Okay.
Me toes on my right is totally paralysed. I can't move my toes at all. But I did have a lot of pain.
So is this no feeling or just can't move?
Can't move my toes.
So you can't wiggle your toes like
I can't wiggle them.
You can feel it?
I can feel it. I can feel my ankle. I can feel my foot. And a lot of it's swelling as well. It's just a mixture of all sorts going on at the same time. Hot, cold, like, where it's burning hot 1 minute, then a few seconds later it's icy cold.
This is all the toes on the right foot?
The toes, leg, knee, up and down in different locations.
And they're really swollen on his feet.
All right, so just so I can understand, so the symptoms that you're feeling is like a neuropathy. So you have the pressure in the lower back and the legs. Right is worse than left. But what you have is sometimes shooting, sometimes stabbing. Do you have pins and needles?
I do get pins and needles in the soles of my feet.
So pins and needles in the soles.
Yeah. And right now I can feel like my ankle is pushing out.
Okay. And so pins and needles. But do you have any numbness? Like you feel when you're touching the ground and walking like this?
I can feel, but it's very faint.
Okay,
I can feel.
So decreased sensation in both.
There's one thing that bugs me with my foot, my toes, for instance. I feel I need to move my toes, but I can't move them, so it feels like they're stuck. But my brain's trying to force it to move, and I can't. So I feel trapped.
Okay, so you have decreased sensation. The toes in both legs, or just more on the right?
Both legs, but more severe. The left one's not as bad as the right one at the
So
moment.
do you have any spasms on the leg?
I get spasms, yeah, I get kicks where I kick out and things.
And when did this start? All this
Going
is
on for
April
a very long time.
or
As
before?
long as I've known him, he's
And we've been 3 years, so I've had the kicking out for a while.
The spasm is about 3 years, but these symptoms of pressure in the back, worse in right, the stabbing, sometimes the shooting, the pins and needles in the foot, the flickering as well, unable to move the toes, the decreased sensation, that is since April.
That's been since April, but there's been evidence of it
It's
before
been
then, but we
before
didn't
April,
realise.
Because he got diagnosed with it in April.
Okay, so it's
But
before.
It's been going on a while. It's
So how
been,
long you think?
I'd say 2 years.
About 2 years.
I've had a few accidents in the street where I lost the feeling in my legs and collapsed.
Okay.
You know when you automatically, somebody's trying to pick you up
Yeah.
and you need to put your legs down. I couldn't feel my legs. I didn't know my legs
So
were there.
is this numbness to the entire?
Waist, from the hip all the way down. I couldn't feel my legs. So I couldn't stand up, even though my legs were working, but I couldn't feel them. And it took about 20 minutes to half an hour each time to get the use of them back. So it's kind of got worse. I don't leave the house now unless I've got appointments. I can't use public transport because I can't walk far enough. If I walk too far, I feel like my legs are getting weaker and weaker and then
How
I
far can you walk?
collapse.
How far can you walk?
I struggle around the house, don't I? I really struggle around the house. I tried to put a squirrel box up today in the back garden, and that is probably 30 steps. And I'm leaning into screw. After that, my back had gone, and I had struggled to get back through the patio doors.
And this, when you start using that?
I started using this. I brought it myself about a month or two ago, but I had a walking stick before then. And I've got a physiotherapist who comes out now, doesn't she?
And this is since April to help with all this.
Yeah.
Yeah.
I was walking a little bit
When?
April, but then as the months got past, gone by and by, walking up and downstairs I can't do very often.
Yeah.
So as it was going by and by each week, it just felt like it's just getting worse and worse and worse. So I spend most of the time sitting down because if I stand up, I feel the pressure.
And do you feel like you'll fall as well?
I do. It scares me, and I have fallen half a dozen times.
We have had to have rails put all
Yeah.
around the house, like for the shower room,
Gateway.
toilet.
There's a council.
How do you shower? How do you bath? It's
I
difficult.
have to pull on a rail. I find it hard to lift my leg. To lift this leg in and out of taxis and up and in bed, I have to use my arm to lift this leg, to swing it. Because the left leg's just about get away with, but the right one I'm struggling with. But there's a council have done a thing called Gateway to Care, is it? And they're the ones that have started to help me with things around the house.
So you have to lift the right leg in and out of showers, cars, and any.
And in and out of bed. It's very painful to go to sleep.
Yeah.
Because I've got sleep apnea, I can't sleep on my back and I use a machine. I sleep on the side, but I have to... They've given me a bit of a bed rail, haven't they? They've recently put a bed rail in for me to hold on to help me get up and out of bed.
So you have CPAP, yeah?
Yes, I have sleep apnea. I've had it for over 10 years.
All right. So that's fine. And sensitive questions, wee is normal. You can
No.
wee.
No, that's got worse. Weeing
What?
and pooing has got more severe.
I'll
Give you an example. I have gone from being able to, back in April, before April, pooing 3 or 4 times a day to very rarely doing it twice a week. And like now, last 3 days, I've had the urge that I need to go and start certain and stuff, but I can't.
And you can't wee. He sits on the toilet for ages and he can't wee.
Do you have a catheter?
No.
Right.
There's also been instances where it's gone the opposite way, where
Okay.
it's fallen out of me and where I've wet myself. I'm wearing a pad now because
Sorry to hear
long
that.
journeys and stuff.
Sorry to hear that. So, so you have retention. So you know when you want to go to the urinate, or you just like, okay, actually I haven't urinated in a couple of hours.
I sometimes get the urge,
Okay,
but
so
I don't always feel it.
So sometimes you get the urge, but when you start you weeing,
I sit down to wee and it doesn't happen always.
okay.
It could take
And
up
the
to half
reason
an
you're
hour
sitting down
before
to
it
wee
happens.
is because you can't stand up. To wee?
I can't stand because I
Can't
can't
stand.
stay standing.
So, and then when you sit down and wee coming out, can you feel that?
Sometimes, not
Sometimes.
always. I have to also lean, I feel like I have to lean my stomach forward in
Yeah,
a certain
yeah.
position to try and support it. And when it's the other end, when I'm trying to have a poo,
Hold on, we're not going so far. But you can see. Do you know when you finished weeing if you've started and finished, or you?
there are sometimes that I don't know I've finished.
So basically, and you've noticed that this wee problem has in April more or less you're fine, and then it's gradually gotten significantly
More
worse.
severe now.
And you haven't had a catheter. You really, so really and truly, you don't know when you need to wee. Sometimes you do get the urge, but majority of times you don't. You don't know when it's coming out.
A lot of it is when I stand up. I feel like I need to go to the toilet. Every time I stand up, I feel like I need to go to the toilet. So I go straight to the toilet, but not everything
Okay.
always happens.
And if you so you have the urge, but nothing else comes out. And when you actually go, do you feel the wee coming out?
Sometimes, most of the time.
Is that getting worse? Is that getting better? Is that stable?
It's getting worse to the fact that I feel like it's coming. I feel like my dick is stopping it because if the sensation hits, like say the tip, and it bounces back, it feels like it's bouncing back as if there's a block.
Okay.
Like I've stopped it somehow with the muscle.
Okay. And then and you know when you finished weeing, or you still having accidents after you finish weeing? You have to strain to wee.
Sometimes I strain to try and force it out. It doesn't always work.
And so do you have sensitive questions on the sensation of your scrotum or your penis is normal, or is that changed?
Sometimes I can feel. Sometimes it feels numb at the end. Sometimes I get like a little, like sitting in a taxi coming here. I felt like it was jolting because I can't. It's like not being able to like get an erection all the time. It felt like there was a stop there, and then suddenly.
So decreased erection, decreased sensation as well. Okay.
But then when it does happen, it doesn't happen for very long. It's like a few seconds.
That's understandable.
But
There's
then
jolting.
Yeah, but then
There's a stabbing pain. Is that what you're talking
I
about?
do. It's kind of a fluster. It's like a fluster. It's like something's flubbering or something. I'm not sure how to describe it.
And that's what, in the penis or the scrotum?
In the penis. No, I don't really feel anything coming from the actual ball area, you know. But there's been times where I've wet myself and I felt it too late. I felt it like a fuzzy sensation at the end, and before I can get to the toilet, it just fell away from me.
And stool-wise, you know when you want to pass stool?
I know what, sorry.
When you want to defecate? When you want to pass poo?
When I want to pass poo, that's the hardest, because there's been times where 2 or 3 times it's dropped out of me when I've been walking. When I'm walking, sometimes loosens it, and before I got to the toilet, it's just fell out of me. And a lot of the time when I'm sitting on the toilet and I need to go because it starts hurting and everything, I'm forcing it, and all I can do is feel it in my chest. I can't feel the muscles down there working.
And this is since when?
About a year, isn't it?
I can't hear.
So
What's
how
the
long-
question?
Sorry. How long has this been going on for?
Same amount of time.
Yeah. But
It's all happening all
That's
at the
okay.
same time.
All right.
So my logic was telling me that because of where the cyst was, it's trapping the nerve signals from the top to the bottom.
Okay. We'll get you into all of that. We'll get it. Okay. Can I examine you?
Yeah, please do.
Okay.
Whatever you need to do.
Yeah. So you wear these shoes here.
Well, I've been wearing them for the last couple of weeks.
This is
A day
foot
thing.
drop splints.
It's a caliper or something. It's what orthopedics or whatever have put on me recently. A couple of weeks.
Because your foot.
Because I can't move my foot or toe, it drags when I'm walking, so I can't lift.
And how long? When did that dragging happen?
Well over 6 months, 6 to 8 months, maybe more. Again, everything's round about the thing, which is just getting worse.
Yeah.
Like if I'm trying to walk up a step, like stairs, I have to drag that foot over the step rather than lift, and I can't lift it.
Okay. So this is the better foot. This is the worse foot.
That's the better one. out of the two.
Bend this one up here. Okay. Keep it up. That's really good. And this one. You can see the muscle here is bigger than this muscle, so you have loss of muscle here. Kick out the foot for me here. Good. And kick out the foot here, please. Okay, so this spot was still normal. Can you move this? I want to see if you can move the ankles.
What
It's
do you mean,
fine.
like just
Okay.
lift?
Yeah, okay, do that. Keep it up. Do that again. Good. And do this one.
I can lift with the ankle. That's how I feel like I'm lifting with
Okay,
the
and
ankle.
the
That's
toes?
it.
Nothing in the toes. Big toe up? Yeah, okay. Big toe up here? That's not really in the toe. And can you push down?
Yeah, I'm pushed down.
Yeah, the other one.
I have to kind of move my leg.
Oh, you have to move the leg. You can't really say. Okay. And the sensation, does this feel normal to you?
That does, yeah, but I know it's a different sensation in my legs.
All here is different.
That one, especially around here, feels like an extra smooth sensation.
Okay. How about this?
I can feel it. It feels a bit. That I can feel a sensation running through the leg.
So does this feel normal to you?
Yeah.
Does this feel like this?
A little bit more like that, yeah, but that doesn't.
Okay. So this, so here and this feels fine.
That feels better than that one, if that
And
makes sense.
and does this feel like this? Or
A bit,
this?
yeah.
A bit. So does this feel like this?
A bit. It's got a weird sensation running through it. Like,
And how about this?
that one doesn't feel like that. Does.
And when I do this,
That's all fuzzy. It
Fuzzy.
feels fuzzy at the moment.
can I just?
Would it be better taking them off so you can see?
I mean, you can, but I already.
got an idea of what's going
Yeah,
on.
yeah.
More than I do.
Fair enough. Move the ankle up and down. And big toe up. Okay, so this is really
can't.
good. When I
I can
touch
move
you,
it a tiny bit down,
when I touch you here, how does this feel?
but I can't. I can't move it.
That's
move
okay.
it at
How
all.
does this feel?
I can feel it, but it doesn't mean anything. It's not
Okay.
the same.
That's relax. Just relax here for me. Put the hand here. That's fine. Just relax. Don't do anything. Yeah, no,
I thought I was relaxed.
it's always hard to relax like this. Do you mind if I?
Yeah, just do what I did.
That's right. Just don't do anything. Drop the leg in my hand. Yeah, good.
I think that's.
Okay. You feel this?
Yeah, I can feel that, but.
And this one here. Okay, that's fine. All right. So my colleague Mr. Rao saw you, who is an orthopedic surgeon, okay, a couple weeks ago. He's an orthopedic spinal surgeon. And he saw, and you referred to him because of the cyst that they picked up in the spine. All right?
Yeah. Yeah, that's what I thought the problem was.
Yeah. So, after he saw you, okay, he agreed that you do have a cyst in the spine. So, this is your scan, Andrew Emerson. This is from April last year, okay? This thing here in the spine, that's what we call, this is what the cyst, or essentially you were referred for to Mr. Rao, okay? Because they were worrying if it was infection, if it was something of the cause. Now that's a right-sided problem that can cause right-sided leg problems. So I think what they did after that, they went and do further scans. It's very hard to see if anything else was happening in the spine at that point in time.
Yeah.
Okay, the spine generally looked okay. All right? That is the MRI from
A few weeks ago. Whatever.
well, no, it's April, and so
Right,
now
this year.
in a day after, you had another MRI in Huddersfield,
Yeah.
or yeah, right,
Yeah.
with contrast to help to figure out what this problem was really, and so they did that, and you can see this is you're looking like a cyst right here. And there's nothing else really in the spine that you can make heads or tails from. So that's why you refer to him for this problem. After he saw you, the symptoms that you describe did not add up to just a cyst on the right-hand side.
Oh, okay.
Because you have the entire leg is going numb, It's affecting your bladder bowel function, and your left leg is also affected. And you're walking like if you're spastic, like you got no control over the leg.
Yeah, I feel like a penguin or something.
Yeah, you look like a penguin. I said it sincerely. I love penguins. Okay. Anyways, no. But what this means is that, and he asked my opinion. Okay, after he'd seen you, he asked me my opinion, and when I looked at the scan based on the last MRI, I said, well, I don't like how the MRI is looking. Let me see you back in clinic. Okay, the reason why is that you do have the cyst right here.
Yeah.
But that is not the cause of your problems.
Oh, okay.
It is a hard conversation to answer now, okay? What is causing the problem is some lesion in the spine itself, the nerves of the spine itself. I want to show you, this is what it is that we're focusing on. So the nerves of the spine, the electrical cable, this is the spinal cord.
Yeah.
Okay? You can see, right? The spinal cord. I'll show you what it looked like in April 2025. You see this black thing here, this black tube here?
Yeah.
This tube?
Yeah.
That's the spinal cord, and you see how it's nice and tapered? It kind of like if you, like has this, so the spine that we're seeing there, it looks like this. And that's how it should look, with the nerves running off of it.
Okay.
That's how it should look. And in April, that is what it is. So everyone was focusing on this problem. I don't think I can see any other problem here. But when Mr. Rao showed me this latest MRI of April, I said, this doesn't look right. So the problem here is that you see that this one tapered bit of the spine, you can't really see it at this level. So what you're noticing is that the tube comes and the tube becomes very, very fluffy here.
Okay.
This, I think, is possibly a tumor.
Oh. Okay.
Okay.
Wasn't expecting that. I just thought it was a cyst that once you can drain it, I can get the use of my legs back. I wasn't expecting anything else.
I know. And that's why when Mr. Rao showed, I said, we need to get you back in the clinic ASAP. I've booked you. So this is...
But this wasn't picked up 12 months ago.
Because it wasn't there 12 months ago.
Ah, right, okay.
So this is exactly...
So the cyst was a separate issue. This is more recent, so it's got more... Something's happened.
So exactly. So based on the symptoms that you're talking about, your symptoms expanding 2 years. So the scans that I've seen, and I've talked to the radiologists about this as well, and they really can't see anything abnormal in the spine from the April last year's scan. It's nothing obvious at all. And so for whatever reason, people repeated the scan for whatever reason, all right? And what it has shown is that the problem is not down here, and to be fair, there is a problem here, which is a cyst, which looks like if it's gotten better. Yeah?
Well, it's got better.
The cyst.
It's got better.
Yeah.
That's really all right, okay.
The cyst has potentially gotten better.
Okay.
But what it's showing is that this is a problem here.
And this is why you've requested a full spine.
Correct. And a brain.
Because I got that phone call this morning.
Brain and spine MRI.
Brain and spine.
And so I think that this is all in keeping with why you're having all the symptoms in the lower abdomen, down the legs bilaterally. You can't poo, you can't wee, you don't have erections, all these different things is because of this. Clearly, whatever is going on has been going on. Common things are common. Maybe it's been going on for 2 years. Okay, but it's just now being seen on the scan because we did an MRI in April. We didn't pick this up at all.
Yeah, okay, yeah.
So between April to now, this tumor has grown. Okay, and a tumor is a swelling. Okay, a tumor is a Latin word for swelling. Now I don't know if this is cancer or this is not cancer. Okay, but common thing and there's many things that this could be. but it's clear that you're getting worse with your function, and so it's clear that we need to action this. Yeah, because the symptoms have been going on for at least 8 to 9 months. We don't have to do anything today, tomorrow, or next week.
Okay.
But essentially, what I think you need is we need to figure out what this is before, and partly because of the way. So that's one thing, and it's sad news to tell you.
Yeah.
And it's hard news to tell you, but the only way I can tell you is to be upfront and tell you.
I prefer that.
Now, the region of the spine that this is in is also makes this ridiculously hard to treat, because the region of the spine, it controls bladder, bowel, and sexual function, as well as the nerves that go to the legs.
Yeah, getting that. Get that.
This problem, I'm not sure, can be cured
Okay.
because of how. Think of it like this: you have the brain, which you power station of the body, and then you have a big electrical cable that is providing electricity to the house.
Yeah.
The problem is that this part of the spine is equivalent to one of the big fuses in before it comes to the house, and this fuse now is all mixed up for whatever reason. It's tangled up with branches. It's mixed up at all. So it isn't a clear thing that you can go and say it's a cyst. I can cut out the cyst and get rid of the cyst, because it's so intricate with all the electricity and the nerves going down. Then it would be a really, really difficult. You're more likely to cause you more harm and lose function, such as complete loss of bladder, bowel, sexual function, and even be paralyzed from the legs down, which can be one leg or both legs, and you can be paralyzed from here down. That's what we're looking at.
Yeah.
It's a very difficult thing because we don't know what this is, and clearly this has been getting worse, and clearly this has been moving rapidly. So I've spoken to so I've not only requested the scans, and what I will probably do is bring you back to a clinic after the scans, but I will discuss your case at the oncology or even though it's a cancer. The name of it is
Yeah, no, I know what you're saying.
The central nervous system tumor meeting. I don't know if this is cancer or not. Very straight. Cancer in the nervous tissue, the brain or the spine, is very rare. Okay. Equally, we don't have a name for this. I can't tell you other than you have a tumor in the spinal nerves. Okay.
Okay.
So once we get the scan, then we present you again at the MDT or the meeting, okay? And then for us to find a plan. What I gather, or what I anticipate that will happen, because this tumor looks like if it is engulfing or it is entangling.
Oh, so it's entwined with everything.
Correct. So it's not like you have this spine and the tumor is growing around that we can cut it off.
Yeah.
You have this nerve, the nerve is like this, the tumor is like this. So to separate this and this, who knows what you'll separate? You understand? I think that we may have to start off with a biopsy to get a name for it, to see if there's any other treatment that you can require, such as radiotherapy or something. And that may require surgery for that, okay? But to be honest, I don't know if we can remove this completely without causing you harm. This is very troubling news, okay, because I didn't expect this when he asked me to look at the scans either. Okay. All right, so this is not something that you see every day. This is probably one of the rarer tumors that we will see. Okay. I spoke to one of my colleagues who does this sort of operation in the entire Yorkshire, and he was the same opinion. Get a head scan, get a body scan, the nerves, see how you're doing. If it is that you were getting worse over weeks, to days, I would be admitting you today and starting you on some dexamethasone or steroid medication. I think that we can still probably do that, but the problem with starting on steroid medication is that if this is one particular type of tumor and we give you steroid medication, then it can shrink the tumor and then we won't have a diagnosis. We won't know what it is. You understand?
Yeah.
So because the symptoms have been going on a little while, I think that we have a few days to make the decision about what is the best way forward before we rush in to do something and give you treatment that you don't need or whatever. The only thing I would say is that I don't like how you're not weeing properly. I think that you probably will benefit from a urinary catheter. I know you probably don't want to hear that.
I had one when I was in hospital, so I know how they work. But obviously somebody's going to have to put it on me because I wouldn't know where to begin with that.
That's fine.
But I've had one where when I was in hospital, those 3 days I was in hospital, I had to empty the bag down the toilet, so I know what they're there for.
To be honest, I think so. I can see how we can try to put in a catheter for you and send you home with a catheter. Okay. The other alternative is I admit you today, and we sit tight because you're going to Halifax. It's a long way away.
That's what's worrying me now,
Right.
because
No.
we were told we tried to get hospital transport from Yorkshire, and apparently they said they won't give me transport unless I'm dying or I've got cancer. My mobility meant nothing to them, so that's why it's costing me like 70 quid there and back.
Oh, yeah, I understand.
It'll cost me that now.
I think here's what I think, because you're not. I think you need a urinary catheter. I don't think you have normal bladder function based on your symptoms. I think if you allow me, we'd admit you, right? Get all the scans done. Where did they say they're gonna get the scans? Here?
Well, all my MRI scans that they want to do is over here. It said it was going to be done Tuesday at Clarendon Wing.
That's good. That's fine. So I think one or two things you can do. You can either go home, okay, but if I admit you, I have to find a bed for you, and nothing would happen over the weekend. You'd just be in a bed.
Well, that would be better if we went home because her daughter's got a party tomorrow, and it's not. I don't drink. I can't anyway, but it's a birthday party, karaoke and all this, that and the other. And if nothing's going to happen over the weekend, then would it be better logically thinking?
If I can get the catheter arranged for you today, you can go home with the catheter. You can even put a bag catheter, okay?
Yeah.
So that means you get a flip flow, okay? So that means you can control.
Yeah, that's what we have done.
Yeah, you can have a 6 hour or whatever. You can get that, and you can go to your party. Okay, you can have a sing, you can karaoke. Okay, enjoy yourself. Okay, don't forget about this. What I've told you. Come back in Tuesday for your MRI, and we could probably and then when I discuss the case, I'll give you probably let you know what's happening. I'll probably give you a ring and say, here's what this is what we've discussed. I won't discuss any horrible news over the phone. I don't deal with things like that. I might have to bring you in, but if you're happy for me to talk to you over the phone or bring you back to the clinic urgently, we can.
I was just thinking about the cost of everything. It's financially, it's.
Well, the last person that I did something like this to, he had to go to the GP, and I asked the GP to arrange for transport, and they arranged transport to bring you in. So
just give us a phone number before, didn't they, to ring?
And then when you ring the transport, did they bring you in?
Just the number we rang, which was Yorkshire Transport, said, unless you've got cancer or you're dying, we're not going to be able to help you. So I'm just sure where I fall. How do I prove one way or the other? I don't know.
Well, I've tried to do this a couple of weeks ago for a patient, and I organised it myself, and I was shot down as well. So the system is not really helping itself. But equally, I think today the problem on the ground today is you need a catheter. Yeah. Equally, you need a catheter. You need you can go home, and you get your MRI. Once I'll review your MRI, present you on Wednesday, and then you'll be hearing from me on Wednesday about what's going on, and we make a necessary arrangements. It may mean that I said come in for an admission, and it may mean that we'll have to see how best to bring you in to be admitted for all these problems, because nothing is going to happen over the weekend.
Yeah, but if being brought in, would that mean in Leeds Hospital?
Yes, here, this hospital.
So if you got me a bed, for instance, I would be admitted into Leeds.
Yeah, you go to near surgical floor.
So because I don't know which hospital and all that.
No, you don't have to worry about which hospital. So we would tell you all these different things. I'm very sorry to tell you this. I didn't expect this at all when my colleagues.
Mate,
told
I've
me
waited a long time for some form of answers. It's been 14 months, and you know it's an answer. You know, it is what it is. That's all I can say. I deal with mental health. I run a family on TikTok, mental health family on TikTok and stuff. And my saying in life is, it is what it is. Can't change it. You can't do nothing about it.
Well, I mean, I'm happy with that approach because it makes things easier and more pragmatic. You have this problem in your spine. I don't know what it is. No one knows what it is. We can try to figure it out together, and we take it from there. Go have your weekend party. I'm gonna see if I don't know how, because normally, I mean, I can ask the A&E doctors, but they will kick off. But I will see if I can get one of the nurses to put in a catheter today. Let me go and make a call before 5 o'clock. So, okay,
Yeah.
and then
If not, don't worry about it. If not, I'll just carry on the way I've been going until thingy.
Yeah, but I don't like this as well.
I've got used to it now. I'm just going to the toilet. I just sit on the toilet for half an hour on my
It
phone.
disappears for like an hour at a
Okay, I
time.
won't put in the catheter. Just kidding. Okay, that's fine. So if it is that you let me make a call. If I can't get it readily and it's moving mountains, I don't think you need to be admitted today. Equally, I'll bring you back. I'll definitely after the MRI on Tuesday. And if after the MRI, don't leave, okay? What I would ask you to do is call. Let me see if Katrina is available. 1 second.
Give me a number. Last night I called, didn't they? Last night I didn't have alright.
Katrina's left. Okay, I'm gonna give you my Helen's number. Who basically her number is 0113. Am I taking this?
Do you want to do that on your phone, Doc?
I'll write it in the book.
Yeah. So the reason for this is once you get an MRI, don't leave. I want us to review this because if it is that this thing has grown, or for whatever reason it's from April, we might ask it. Listen, let's admit you until we get this decision.
I work this out logically on Tuesday when I come back for the scan. The MRI. Do I go home after that? After I've had the MRI and then ring that number?
No.
What?
You come with the MRI. You give us a call. I've had the MRI. Just let us know. Okay, what time is the MRI scheduled for?
6:15.
Quarter
In the
past
morning?
6 in the afternoon.
Oh, afternoon. Oh, I see.
The last one, I think.
Yeah,
Probably the
yeah,
last
that's
one.
fine. So I mean,
So I think it's only. She'd get the result. You want it done by Wednesday, so.
we just need the
your meeting
scans.
it Wednesday.
We just need the scans, and so the alternative is I don't want to tell you that we're admitting you and we don't have a bed. How is this gonna work?
Not only that, it's the hours you work as well. If you did scans, not going to be done till
I'll tell you what.
past
No,
6.
I'll tell you what. You get a scan, and I'll arrange it for you to be admitted on Tuesday evening, so you don't have to think about going back to Halifax. So you'll be admitted on Tuesday, no matter what. We'll have our meeting on Wednesday, and then we'll come and talk about everything else. That's the best thing.
So Tuesday afternoon.
So he needs to pack a bag because I won't
Yeah.
be able to come with him on Tuesday.
Yeah, prepare.
That's how my
prepare that.
logic is then.
No, that's fine, and I'll make the necessary arrangements for you to be admitted on Tuesday. All right. Hook or crook, you've been admitted, even if
So
there's no bed in the
How
hospital.
long will it be in about?
So I don't know the answer to that.
That's where that meeting on Wednesday is going to be.
So
and
we
then
have a
you can
meeting on Wednesday.
make a forward plan.
Exactly. So because I don't want you to go and if you're coming by yourself, fall down or having to worry. So last MRI, choose Wednesday. You get we discuss we may have to prescribe some medication. We may say, okay, you need an emergency biopsy on this list, blah blah blah. We talk about all these different things and we take it from there, because this is something that I don't think we need to sit on, because clearly. All right. So let me see about catheter, and if not, we'll just bring. Let's just say on Tuesday, just keep on doing what you're doing. Give me a second.
Do I need your secretary?
No, that's fine.
No, she's going to sort something now, but